Hello and welcome to the Passion and Possibilities video series for women preparing for motherhood. And I'm Charlotte Kanyi from Birth Essence, and I support women to be confidently themselves in birth. And this series is all about inspiring women to know what is possible, to support themselves for a wonderful pregnancy and birth experience. And today I'm welcoming Heidi Danaher from the Isle of Man, who will be speaking to us. Hello, Heidi, who is a mother herself and also a pregnancy yoga and hypnobirthing instructor in the Isle of Man. So welcome, Heidi. Hiya. So tell us a little bit about yourself and how your passion to support pregnant women developed.
Well, I've been teaching yoga, just general yoga, for 20 years, and quite a lot of pregnant people kept coming to the class, so I did a training course in order to make sure that I was teaching them correctly. And then as part of the training course, I was required to do like a teaching session. And then from that, it just continued because the people wanted to keep doing it. So 12 years, 13 actually, maybe 14 years on, and they're still doing a regular yoga class. And then I ended up adding in hypnobirthing as well. Just to really help people get through any worries or concerns they have about birthing as well.
Wonderful. And so tell me a little bit, I know hypnobirthing has become more common, especially since Kate Middleton did it, and people have heard of it. But for those that haven't, and even those that have, what is hypnobirthing exactly, and how does it help you when you're giving birth?
Sometimes the word hypno gets people a bit kind of like suspicious about it, thinking it's some sort of something like stage hypnotism on TV, but it's not really. It's just basically learning how to relax and clear out any fears or concerns that might be pre-programmed in there from your life experiences or from your own birth, and helping you feel more empowered and able to be informed and make decisions from a place of being informed. Rather than just kind of going in blindly, hoping for the best and see what happens, which, you know, sometimes can work for people, but other people have concerns about birthing, and just even going into a hospital environment puts them on edge. So it's being able to kind of release that fear and stay as relaxed as possible in order for the body to actually birth the baby. Yeah. So I know some people have said, you know, I remember somebody years ago said, oh, actually my body was doing a really good job. It was just my mind that was getting in the way. And as soon as I kind of tried to let go of controlling everything and focus on the breathing, then it just became a lot smoother, and everything just continued in a lot easier way and a lot more manageable way. So it doesn't necessarily promise a pain-free birth, but people say that they find that with the techniques that it's a lot more manageable. And actually, some people even say they've enjoyed it and want to do it again. So everybody's experience is different, and everybody's life experiences, and everybody's concept of pain is different as well. So it doesn't necessarily promise pain-free, but it definitely helps. And some people have noted that, you know, even though it's been intense, that they've actually found it a lot more easier than they had thought it would be, based on all the stories that people had told them.
Excellent. That sounds wonderful. And how has hypnobirthing helped you personally? Did you use that during the birth of your son? I think he's about 3, is he now? Or yeah,
just turned 4.
Just turned 4. Oh, you're behind. Time flies.
Time flies. So yeah. So having done hypnobirthing classes for years, it was amazing to actually have the opportunity to use it myself, although I felt slightly under pressure because people were like expecting me to have this kind of floating on a cloud birth, which it was, you know, a really good birth. It didn't have any pain relief, didn't feel I needed any, and I did use quite a lot of the techniques, the breathing techniques, and I also listened to quite a few different hypnobirthing programs just to see if there were any differences. And basically they all come down to clearing out fears, focusing on your breathing, and being informed about what's actually going on in the body. So I used a combination of different ones and used the relaxations throughout my pregnancy just to help me actually stay calm I did anticipate having a home birth, but that wasn't to be in the end because they didn't have the staff to support it, and being over 42 weeks and over 40, they weren't too keen to send anybody out. So I did end up going into the hospital, and it turned out actually it was fine. And my sisters were there to support me. So I actually had a really good experience, even though it wasn't necessarily what I'd anticipated it to be. And that's another way how hypnobirthing can help. It can help you kind of manage the kind of twists and turns that of the journey that birth might take, because we can't necessarily plan it, and so sometimes people have in their head an idea of what they think their birth would be like, what they'd like it to be, and sometimes it's different, and it just helps you to be able to, okay, so things have changed and we'll just manage it another way. So yeah, it did really help.
I think it's really inspiring, the fact that you had a change of plan and you were still able to stay with you, stay tuned to, and in this calm zone, you could kind of take your hypnobirthing practice with you and into the hospital and have the birth that
you can take your breathing wherever you go. So it's something you've got with you all the time. There's no fancy equipment required, and it just helps you kind of come back into yourself.
Yeah, that's really wonderful. And what would you say to someone who, you mentioned it a little bit at the beginning, where they're thinking it's a bit like stage hypnotism, or they're a bit doubtful, or this is just for hippies, this isn't for me, or they don't see themselves as being someone who would benefit from hypnobirthing, but we're curious about these things when lots of people are talking about it. So what would you say to someone who's curious but a bit doubtful?
I'd say to speak to other people who've tried it, and perhaps even research online, because there's hundreds of people doing it now. Lots of famous people have done it. Even their partners have said how amazing they thought it was. And also talk to your partner about it, or whoever you're having there with you as your birth companion, because to get them involved, I think that's a really important thing, because otherwise, when somebody's pregnant, they're going to all the antenatal classes, clubs, aquanatal, or whatever they're going to, and they're meeting up with other people and talking about things all the time. Whereas the partners, it's not actually happening to their body. And to actually get them involved as well, it gives them like a toolkit of things that they can have to help. And sometimes, just having them there feeling prepared and supportive can make a big difference. So yeah, I'd say to talk to other people and find out what their experiences are of using it. And also to have an open mind, do some research and just speak to a practitioner and see if you get the feeling that you want to actually do it with them. Because some people do an online course, some people just read the book and that's enough for them. Other people want to have a one-to-one experience and to talk through things and to have some reassurance and to get their partner involved. So everybody's different, so it's finding the right one to suit you.
Yeah, and there's quite a lot more available now, isn't there? Like there's groups, there's individual, there's online, there's the book, there's all these different methods of accessing.
Yeah, so there's some people want to do it in the comfort of their own home and get their partner to watch videos as well, and other people find it easier to go to a group setting where they've allocated that time, and then they also meet other people as well, other couples, other pregnant ladies, and then they can develop a bond and share experiences with them too.
That can be really helpful.
Yeah, and also when I do group courses, we have like a little reunion afterwards, and sometimes people find that they make really good, strong friendships having done the course together, because of course their babies are born around a similar time, so they really understand each other's journey, and so it's really lovely to see that those friendships that are formed and continue from them having their babies. Yeah.
Wonderful. That sounds really lovely. What do you feel is the key to success for someone trying out hypnobirthing?
Well, I mean, all the books say that you need to practice and really kind of make the time for you to learn the relaxation techniques. Even if you're awake in the middle of the night and you can't sleep, which can often happen in late pregnancy, then just put on the relaxation tracks, because that's conditioning the subconscious. Some people discover it really quite late on and they still find it really beneficial, because there's something in there that's really helped them clear through any fears that they may have. So the more you can kind of embrace the techniques and just practice little ones throughout the day, then it doesn't take up that much time, but you can actually make a big difference to how the birth would unfold.
Yeah.
And some people, they don't know, you know, had they not done it, would it be different? But often you find that people who might have had a tricky first birth and then they've done it for their second or subsequent births, they've noticed a huge difference and how they manage their experiences of birth, and how they also manage their interactions with their healthcare providers, such as you know, putting in their notes that they will say if they actually want to have pain relief, as opposed to somebody asking them and then perhaps that puts that in their mind. Or if the healthcare provider asks them or the midwife asks them, then they'd get their partner to ask them the same question, and then they might give a slightly different response because they're more likely to be compliant with, you know, a medical professional as opposed to their partner. So to have that, you know, where they're working together and having discussed things beforehand, what they would like ideally and what they don't want to happen, then their partner, their birth partner, can be their advocate for what they would like in order to guide the birth, hopefully in the way that they would like it to go.
Yeah. That's quite interesting, because I did have something along those lines for myself, because I listened to a lot of different tracks like you did. I couldn't find a group. I did want a group, but at the time there wasn't one fitted for my schedule for my first birth. So his was very much like the kind of idea of a hypnobirthing, or calm and everything. It was quite like that for my first child. And then in the second child, I hadn't been listening to the tracks as much, because I kind of thought I've done it. But I did listen to them occasionally, but then towards the end I wasn't listening. I was all busy looking after the first child and so on. And then I had a period where I got scared, and there was some high blood pressure and I was tense. And I just thought, I checked it out medically, there was nothing wrong. It was just coming up for me like that. And I put on the track that I'd listened to the most with my first child, and I just went, boom. And it took me right back to the relaxation that I had with him in like 1 second, as soon as I heard the music coming. And so the point you made about repetition, it hadn't left me. It was still there, that, when you hear that, and relax. And it took me straight into meditation, and then I was right in there.
Yeah. The more you practice, the easier it is to get to that space of relaxation in a quicker amount of time. Yeah,
your body remembers. You can take those music tracks or whatever you did to practice the breathing into the labour room, and your body remembers and goes, oh yeah. And you've kind of primed yourself for success. And like you said at the beginning, success is however your birth goes. It's I think you mentioned it earlier on, that it's not necessarily quiet, and it's not always looking the same for different people. I know for my second I was very loud, and for my first I was very quiet, and I take that a bit different personalities of the children, different birthing, and I still use the hypnobirthing very well in both of them, and being loud didn't stop me being relaxed, if that makes sense.
Yeah, because also sometimes when people ask you, you know, people would ask me afterwards, did you hypnobirth? And I was thinking, what are they expecting me to say? Are they expecting me to kind of just have gone, and the baby just appeared? and I actually had to think about it for a while myself and think, you know, actually, what is it? It's just being able to birth in a calm, as relaxed manner as you possibly can. And if that means that there's sound, that's fine too. And so, yeah, people have different perceptions. And I remember reading something not so long ago, and it was somebody that anticipated, because they'd done hypnobirthing, that everything would be like fluffy clouds. And if it wasn't, then they wouldn't think they'd done hypnobirthing. And so actually, you know, I remember being with a midwife, and she was telling me that somebody was during labour, she was saying, but I wanted to do hypnobirthing. And she was like, you are doing it, you're breathing. Just because she was making sound, she thought that she was perhaps not doing it. And so, you know, birth can be with sound, people make lots of sound. And also when you're doing a hypnobirthing course, it's quite nice for the partners to come along and think, oh, actually, yeah, that's totally normal. Rather than them be actually freaked out at the time thinking, oh no, and start to panic. So it can help them feel a lot more relaxed about birthing as well. And then if they're relaxed, then they can be more supportive to their part.
Yeah, catching atmosphere for everybody.
Yeah.
And what do you recommend to women who are trying to choose which course to do? There's quite a few different ones out there.
Oh, there are. I think to speak to, if you're doing one with a practitioner, to speak to them. and to actually ask them about the course, and then you get a feel of whether you feel that you'd like to do the course with them. If it's an online one, then you can just look up the person and listen to their voice. Obviously, you'd need to like the voice, because you can put on some relaxation tracks, and if the voice is annoying, then it's not going to work for you. So if you find that they've got a soothing voice, and that you just feel that they're kind of in tune with how you are, then that's the easiest way to choose, I suppose. And then find out what's available locally, and also just check out online, because also quite a few of the people would have done a similar course, however they present it, and some people have different backgrounds and experiences. So I teach pregnancy yoga as well, so that's my background, so I might add in a few different breathing techniques from that, or different positions that might be helpful. Other people have a background in midwifery, or NLP or mindfulness. So yeah, it just depends what avenue you'd like to choose.
Yeah. And so do you find there's some crossover with some of the things you teach in your yoga with the hypnobirthing?
Yes, completely. And I find that in the yoga class I teach the hypnobirthing techniques, and in hypnobirthing I teach the yoga techniques, because it's all to do with breathing and initiating the relaxation response and keeping fear out of the birthing environment as much as possible. So, and some people, they'll just come to the yoga and they'll find that actually the yoga techniques are very similar to hypnobirthing anyway. Other people want to have a bit more in-depth knowledge and information about birthing, and so they want to come to a hypnobirthing course and then bring their partner along as well to have them involved too. And that can really kind of, bring them together as a partnership prior to the baby arriving.
Mm-hmm. Yeah. And what kind of things do you teach in a pregnancy yoga class? How does that work?
Well, the pregnancy yoga class is generally some stretching, just to open and release the body, and to free up any tight areas, to strengthen the body so that you can breathe through intensity of labour. Also, we do certain postures, and all of them are suitable for pregnancy and usually during labour as well. And also we do pelvic floor exercises, we use the birth balls, we do birthing positions, and also we always include a session on breathing and relaxation. And then we have tea break time afterwards. And in the tea break time, then that's where people kind of get to know each other and chat about their experiences as well. So it's a lovely experience to teach it, and also it's nice to be part of it, because when I was pregnant, a colleague of mine, she took the class for me, and so I could attend the class myself, which was really lovely.
Oh, what it was like from the attendee point of view as well.
Yeah.
Yeah, I think the tea and coffee part can be some of the really most important part of some of these classes as well, when you're in a group like that. When you
quite a lot of them say that they're coming for the relaxation time at the end. They can lie down and all, kind of like almost asleep but not asleep. They're still awake but in that relaxation. And so often I bump into people and they say, "Oh, I have such happy memories of going to Saturday morning pregnancy yoga, and it was just lovely." And then they miss it once the baby arrives, because they're kind of so busy with the baby. They're like, "Oh," but I do a postnatal mum and baby yoga as well, so they still get the opportunity to come along with the baby.
Yeah, that's wonderful to be able to access it again afterwards. And relaxation is just such an important thing that we tend to skip over for ourselves, or when we get busy, we sort of that gets put to the side. That specific time in a class like yours, or to set aside to come back to yourself and relax, is so important.
Yeah. And even you can do it throughout the day, even just short little, breaks throughout the day. But it's really nice to go to a class where everybody's doing it, because then you get that collective vibe of everybody relaxing. Yeah. And that helps you kind of get into it a bit more.
Yeah, wonderful. And what do you find awe-inspiring about women giving birth and birth itself?
I just find that people can really discover themselves, and that they find within themselves this kind of sense of power that they didn't know they had. And, they sometimes write and say, "Gosh, it was absolutely amazing." There was one lady last week, she said she had a baby in an ambulance. It came so quickly, but she found that the whole experience was amazing, whereas somebody else might panic at that thought, but she said it was absolutely brilliant. And so I think some people really discover a sense of who they are, and also that sense of empowerment that they've actually had a baby. It's amazing they've created this child, and 1 minute it was in their tummy, and the next minute it's like here earthside in real life. So yeah, it's amazing. Here's some lovely stories, and so it's great to be a part of it.
And what breaks your heart that you would like to see change for women becoming mothers?
I find that it must be challenging for midwives working within the system, because they have only so many resources and so much time that they can spend with women. And even if they really want to kind of create the best possible experience for them, sometimes they're led by timescales or procedures, and they have to follow those. And there's some amazing midwives working in the midwifery area, and lots of them these days are doing hypnobirthing, which is really nice, because that means it's kind of like from within they're getting that support. And then also if they do courses themselves, then when they go and they have somebody who's actually either familiar with the techniques or willing to embrace it, then it can change the whole course of their birth and make them feel really supported. So yeah, it's hard if you hear a story where something's happened against the woman's, against her understanding of, like we talk about informed consent. So sometimes people need to know the full details of something before it happens to them. And so that's where I think hypnobirthing can really help, because you can find out, the kind of things that might happen in labour, and know that whether you're actually expected to do it or whether it's a choice. So for example, something like a sweep, or even having an internal examination, it's your body, it's your choice. And so actually by understanding it's your body and your choice, then it's almost like you're allowing somebody to do that if you choose to do it, but you know that you don't have to if you didn't want to. So I think that's, it's always good to be informed.
Yeah, excellent. So if there was one thing you would like women listening to this interview today to take home, to apply, or to take to heart to inspire her, what would that be?
Wow,
difficult sometimes, isn't it? Everyone goes, one thing.
One thing. There's loads of things. But just to simply believe in yourself. Know that you can do it, and that there's loads of support out there. And these days there's tons of support, whether it's through your partner, through the internet, through your friends, through going to a course. There's lots of support, and so take it all and embrace it.
What was the best thing about hypnobirthing for you? What did you love most about it?
About teaching it or doing it myself?
About receiving it. When for your birth experience.
Oh yeah, I was going to say, because I didn't do a course, because there wasn't one to attend. For my birth experience, I think it was, well, for me, having my sisters there was an amazing part for me, because they really, having had 14 children between them, they really, know a bit about birthing. And so that was like a really amazing support that I had, and that I knew that they were there to support me, and they knew almost instinctively what I wanted. And so because they were there to support me and they knew what I wanted, they would do their best to make sure that happened. And even if it wasn't going in the direction that I wanted it to, so for example, it wasn't having a home birth, but they were there to support me and be with me along the journey. So yeah, that was the most amazing thing for me, having that support.
Wonderful. Excellent. So is there anything else you'd like to share before we close the interview today? It's just it's so lovely chatting about the inspiring stories and how it's helped you in giving birth, and I can't believe it's 4 years.
No, and actually I found an old digital camera, because everything's on your phone these days, but on the digital camera had some pictures of the birth. Oh, wow. And so I've just been looking at it the other day and thinking, oh, so lovely. So I might have to put it into like a little slideshow thing. I didn't video it, and
Mm.
I mean, it was a bit of a shock as well to actually once 1 minute the baby's in your tummy, next minute it's in your hands. It's like, how did that happen? It's amazing and very surreal at the same time. So, and now he's 4, so.
And now he's 4, yeah.
People do say to you, it really does fly by. And those first few weeks, sometimes you're thinking, this isn't flying by. Gosh, it's quite tiring and it's exhausting. But overall, it does. And when people say it, you kind of think, how do they, what makes them say that? But it does fly by. So enjoy the journey.
Enjoy the journey, get the support, and know you can do it. Wonderful. So thank you so much for chatting to me this morning. I hope that our chat inspired some women to look into what other support they can have, whether yoga or hypnobirthing, and to feel that they can do it and there is the support out there. And I look forward to speaking to you again soon.
Thank you.
Thank you.
Okay. Bye.